Hi, everyone. Happy Friday.
Happy Friday to you.
We're going to begin with Ryan Belmore of What's Up Newport. Governor, hotel and bed and breakfast tell us they desperately need some guidance on when they can open reservations up to domestic travel customers. To reopen, they say they need several weeks' notice to build up the reservations, bring back staff, and to prepare. Can you commit to a date today for the lodging industry to make plans for their reopening?
Yeah, so first let me say I hear you, and I'm sorry it is so tough for your business, and we are going to find ways to help you reopen and also figure out ways to help you economically, because I know this has been an unprecedented time. Today I cannot commit to a date. Here's what I can say. It's a priority for us. Technically, we never really closed hotels. Having said that, I understand exactly what you're saying. For the next 14 days, we still have the restrictions on domestic travel. So, we know that that is the case. This is at the top of our list for phase 2. So, we need to get through next week. And then this is at the top of our list for phase 2, right along with restaurants. So I guess what I'm saying is, hang in there for another week. I'll be able to provide you much better guidance in about a week. In the meantime, know this, the Commerce Department is engaging with the hospitality industry, hotel owners, bed and breakfast owners constantly, and taking your feedback into account. We need to hear from you. What would be most helpful is if you could send us your ideas on the Reopen RI website around how you think it would be best for you to be able to reopen.
Steve Alquist of Uprise RI has our next question. People representing Latino, Black, and low-income communities have expressed concerns about your plans to reopen, noting that the negative impacts of reopening under COVID-19 will hurt these communities more severely. Do you share their concerns?
I'm going to let the doctor answer. Sure.
Do you want me to repeat it?
No, I'm good. Thank you. Yeah, these are concerns that people are evaluating throughout the country. We know the communities that have been disproportionately impacted and are laser focused on making sure that those communities have what's needed in terms of access to testing, activation of appropriate case investigation and contact tracing, and the services needed for quarantine and isolation. And we're going to continue to stay focused on this area. The governor shared yesterday the items that we are watching that says we can go forward. It includes making sure that for our communities most disproportionately impacted, we have the resources focused on what's needed. We're going to continue to engage directly with communities, continue to hear feedback, and have a strong team that's in place ready to make the adjustments that are needed. There's work to do, and it's what we are focused on to help ensure that the communities hardest hit are addressed and supported during this time of reopening.
Our next question is from Hannah Dickinson of WPRI. The state is testing nursing home residents without symptoms, but has said it doesn't want to test asymptomatic people in the broader public yet because results are less reliable. Is this a double standard? Why or why not?
I appreciate this question. We've had this conversation. The message is still the same, that the test for COVID-19 works best on people who have symptoms. That is the primary approach. When we use the test on people without symptoms, it is less reliable, whether it is in a congregate setting, in a nursing home, or whether it's in the public. When we have used it in our congregate settings, it's because, as I've shared, we need to be as aggressive as we can be. And even though that test result is less reliable, if we can get information about someone who may be positive, it gives us the opportunity to act on it quickly. Because it's less reliable, when we get a negative result, in those situations, we do not react to that. We don't say, okay, we're done because you're negative. We still consider the person to be at risk of being positive, knowing that it can change any day. So it's a tool that we are using When it's on people who are not symptomatic, it is less reliable, but it still gives us something to work with. And because of what we've shared in our congregate settings and in other places where we really want to understand what's going on, we'll take it knowing the fact that it's less reliable and there's less information we can get or use when it's negative. It's helpful when it's positive because then we can react and make some changes based on that information.
Thank you. Bill Bartholomew has a question for you, Governor. Is there anything besides a massive increase in confirmed cases that you were monitoring during this initial weekend that may cause you to pause moving to phase one?
No, not really. And because if everybody rushes out this weekend, let's say everybody has big family gatherings and barbecues and picnics for Mother's Day, and let's say next week everybody rushes back to work, we won't see the negative effects of that for about 2 weeks from now. So the hospitalizations will climb 2 weeks after the behavior that would happen, say this weekend or next week. This weekend, I'm confident that we won't see an increase in cases because 2 weeks ago, we had excellent compliance with stay-at-home order and mask wearing and such. So at the moment, I feel good, I feel confident. You know, I couldn't imagine a scenario where we would start to see a big spike this weekend. As I said, 2 weeks ago, people were doing what they were told. The problem is, if we don't all obey next week, and it's a risk, right? We're all sick of being shut in our houses. That's why I keep saying, take it slow. Because then 2 weeks from now, we'd have a problem, and that I think it'd be horrible to have to go backwards. So it's so much better to take it slow and increase and never have to go back. So that's how we think about it.
WPRO's Tara Granahan asks, what will the fines be if you find a business operating illegally? What's the cap?
Yeah, so it's a series of fines. It'll all be out on the website. It's a graduated step up, I think, to $1,000 or two, and then after a series of after I think a few instances of non-compliance, in the most extreme instance, we could shut the business down. Again, that's not the goal. The goal is to say, how can we help you comply? And to help every business to be in compliance, because we don't want to be in the business of shutting businesses down. Having said that, we will enforce it, because it's in everyone's best interest to follow the rules.
Next question is for the doctor. Paul Parker from the Providence Journal asks, what percentage of people who tested positive 14 or more days ago survived at least 14 days after testing positive? Is it fair to say they have recovered?
Yes, the overall approach to assessing recovery is to look at the 10,800 positive tests that we've had and subtract from that the number of people who have unfortunately passed away, which is the 399, and then take into account the 14-day lag that can occur. So as I had shared earlier in the broader context, Rhode Island as a state tends to have an overall lower mortality rate compared to our neighboring states. So a larger proportion of people, both in congregate settings as well as in other settings, are living after obtaining COVID-19. So that's something we will continue to assess, but our recovery number continues to go in the direction we want it to go, knowing that every life matters. And so there's definitely still improvement that we want to work towards.
Thank you. Our next question is from Jordan Mazza of ABC 6 News. The Warwick Police Union says the mask order is, quote, is likely to incite fear and anger in our community. Are you concerned about that possibility? What will happen if officers choose not to enforce civil penalties?
Yeah, it's a good question. So I'm not particularly concerned about that. It's my expectation that we will continue to be kind to one another and help and support one another to follow the rules. So as I said a few minutes ago, The name of the game here, the intention, is to promote and enforce and encourage voluntary compliance. It's in everyone's interest to follow the rules, and it's in Rhode Island's interest to follow the rules. So I hope that it doesn't incite fear. It's not intended to. Massachusetts has a similar order. Connecticut has a similar order. It's recommended by the CDC. We know mask wearing is effective. It's strange, to be sure. It feels a little weird, but it's very effective. It's very inexpensive, and it is so, so much better than having to shut down the economy. So that's why we decided to do this. What happens if police officers don't? I mean, this will be enforced. If certain police officers choose not to, the Rhode Island State Police will enforce it. But the goal is to rely on our public safety officials to de-escalate the situation. You know, we have excellent police officers and excellent Rhode Island State Police. They're expert in de-escalating. So it's their job to use their skills to de-escalate a situation, ratchet down the fear, encourage voluntary compliance, and use their judgment around when they would have to do enforcement. So that's how I think about it.
Nancy Thomas of RI News Today has a question about the living arrangements at nursing homes. She says most nursing home residents are now restricted to their rooms with about 2 feet of space around their beds. They don't eat together anymore or have activities. No one visits. Many watch these press conferences daily. What steps are we looking into to improve their living situations?
Yeah, what is shared acknowledges the fact that it is challenging. It's heartbreaking that we've had to take this approach, but we know that it's also life-saving. And it's why I mentioned how real it is that nursing home residents have 2 families. The staff who are there at the nursing home, the administrators really are there caring for them and want to help provide support for their actual family to be able to engage with them in creative but safe ways to do that. The more we can work to get our hands wrapped around this, the more we can both think creatively to support our nursing home residents and the staff who are caring for them, and then hopefully be able to work towards steps that allow us to do more and to allow for additional ways to engage.
I want to say a few things. That is a heartbreaking question. You know, as you hear it, it is absolutely heartbreaking. And so to any of those in assisted living or nursing home listening, I want you to know we love you, we care for you, and we know how hard it is. I also want to say that we have a lot of plans that we're working hard on. The Director of Elderly Affairs, Rose Jones, is extremely focused on this issue of isolation and loneliness among folks in these communal care settings, and so is working really hard to figure out how to get creative with you know, virtual interactions, just to allow our loved ones who are in those settings to have more interaction, more entertainment, more sensory interaction, even if it's virtual, for the next month or so. So we're working hard on that, and I expect more will be announced in the coming days and weeks.
Daniel Kittredge of the Cranston Herald asks, can you elaborate on how the decision will be made on when outdoor dining will be allowed? Will it be tied to specific triggers?
Not so much specific triggers. As I said, we've hit all the triggers to get into phase 1, and we would like to enable outdoor dining in phase 1. We just need a little more work. Frankly, we're working with restaurant owners and public health officials to try to figure out under what guidelines can it be allowed. And I'm very hopeful that Monday or Tuesday next week I'll have much more to say about that. We're also working with municipalities because we're going to have to make more space available, right? Not every restaurant has outdoor dining, so we're going to have to figure out ways to enable the use of maybe sidewalks, streets, parking lots. Like we want to enable this for everyone. But the facts are clear that it is safer to do outdoor dining than indoor dining, so we want to go out of our way to enable it.
Thank you. Our last question today is for Dr. Alexander-Scott. This is from Tanya Signori of the RI Echo. Does taking a zinc supplement help with prevention of COVID-19? Also, can it lessen the effects of COVID-19 and those that have tested positive? Are there any other vitamins or antioxidants that you would recommend?
Thank you for that, Tanya. There are many different medications, treatments, vitamins that are being explored with COVID-19. There are no randomized controlled trials that confirm that zinc or any other vitamins or antioxidants are actual indications or treatments that could be used for either prophylaxis or for recovery of COVID-19 at this time. But there are scientists throughout the world that are working on updates both from a vaccine standpoint as well from a medication standpoint. But I am not aware of zinc or other vitamins at this point having a difference in terms of preventing or treating COVID-19 from a study or trial standpoint confirming that.